start up and keep going. I think every time I try to give a talk, I try to try some new things out in my presentation, and some of the things I tried you're going to see, and you're going to be the first viewers of that. I'm a lung and critical care doctor at Apollo Hospitals. I'm the kind of doctor you don't want to see. I was fairly popular during COVID the people didn't know who I was, but I was taking care of them because they were unconscious and on ventilators. But at the same time, today's keynote is really to kind of share a perspective that I have from the bedside, but also a perspective that I see from my interest in research. Ramji has been known to me for almost a decade now, and it greatly thank you for inviting me to give this presentation. I think one of the things we want to think about when we are talking about startups, when we're talking about research, when we're talking about entrepreneurship, is not to forget that at the end of the line for all of this is the patient, in the healthcare perspective. If you're looking at startups from an agriculture perspective, there's a farmer at one end of the line. If you're looking at it from a chemical industry perspective, there is a patient or an industry that needs this very specific chemical. So whichever industry you take as a startup, there is some human or a process that really depends on what you do to succeed. So I believe the ideas are essential, but persistence is even more essential. Anybody know what the number is? It's not an eye test. But that is the Indian median age. Most Indians are young. There's only 75 million people above 60 years of age. Some are in this room, I know, but I'm getting there too. But really speaking, 1 billion Indians need to get old in the next 30 to 40 years. That's a huge amount of things that need to get done. We're all seeing the inefficiencies, the challenges that other countries are facing who have older populations. But you can clearly see that unless we fix many of the issues, which are both biologic, systemic, process-oriented, we're going to be in big trouble. I think, what are the challenges? There is no time to think. Time is obviously of the essence. There is no money to act. There's not enough mentors. There is not enough academic support. There's no project plan. There's no true research culture except in certain, I would call, islands of excellence in an ocean of mediocrity. And of course, there is no ideation at the bedside. And partly this is because there's so much work to do. There is no real push from the top to actually do research except in certain places. Absolutely, things are changing. But for a world that has 1 billion people who don't have anything and 7 billion who have something and a very small percentage who actually have what they want, there's a huge amount of work that needs to get done. I think very briefly my story. When I was in medical college, when I was in high school, I was just interested in research. I ended up making paper out of water hyacinth and chopping up earthworms because I didn't want to kill any animals. I thought earthworms will regenerate, so I'm not really killing anything. I tested them out as a high school project. And then in med school, ICMR had a little thing on the notice board saying, hey, if you want to do research, you'll get 1,500 rupees. In those days, that was a big deal. So I actually applied for it and got a small scholarship to do some filaria research. And then, when I went to the US, I trained in the US and did my med school in India and my further training in the United States. Came back to India about 2011. And over there was so much of research going on. I would kind of hang out in the labs and see so much happening. Now, fortunately for them, in Western countries, they have huge support from industry. They have huge support from their institutions. There's a lot of money that goes into this. But I think that's a process. In India, it's happening at very large scale, but obviously a lot more needs to get done. And we need to get this culture of research right in from the start. I was always curious, and I think I had very good role models in terms of really looking up to seeing what we could do. My father was one of them. And one thing that I do very interesting, kind of like how a pilot claims for a number of hours of flying, I do remote intensive care for the United States from India. So I've been watching patients during the day here and the night in the US. I'm their critical care doctor. I'm resuscitating people, I'm giving them medicines, giving orders, etc. And about 14,000 hours of doing that. And we started the same model in India. And there's just a little background of kind of why I ended up in this place, why I'm in this auditorium today, to kind of talking to you today. That's the world population last week and earlier today. There's about 8 billion people. I asked ChatGPT, hey, can you make me a picture of the remaining 7 billion? It said, hey, I can't, but this is a representative image. Do you like it? So there's a huge gap to fill. There's a gigantic gap that we need to fill in terms of what we need to deliver to people, as I mentioned earlier. Now, pretty much everybody wins or loses. And startups, as you know, very small percentage of actual success. Most fail in year one. Only 1% or less become unicorns. Ultimately, everyone dies. We forget that. Everyone dies. So you don't have that much time to really do stuff. A 100-year-old man lives for 36,500 days, all put together. That's not a lot of time. So I think when you're really looking into the space and you're looking at what you're trying to do, it's important to take care of your health, which we'll come to shortly, but also realize that what you want to achieve needs a lot of planning. This is what we do at Apollo Hospitals. We've done a bunch of stuff in this space. We have a division that does Apollo Research and Innovation, and it's just a vertical that now does multiple, I would say, startup incubations. We have a lot of clinical research going on. We have a lot of publications that come out of the hospital now. We're a large system. We're a private hospital, but we really have multiple verticals doing a lot of things. And I've been fortunate to be involved in some of these. And these are just some of the articles that I've written and some of the things which we do. On the top right, you see something which we do, which is interesting, which is do remote critical care. And on the bottom left, a similar picture of that. I bring this up because these are areas ripe for innovation. These are areas which really need to improve. And which I'll show in a very short slide shortly. There are some things we really need to get done to improve efficiency. Even now, my bandwidth when I'm looking at videos of patients around the world is not good enough. I don't have efficiency in looking at AV communication. When we can actually send probes to an asteroid and get it off course, why can't we fix these simple problems? I think they're probably not priorities for many people. And I also think perhaps business is on purpose delaying some solutions for commercial reasons. I'm not blaming them, but I think it's important that innovation jumps to the front line as soon as possible. This a picture on the top right is what we did at our annual conference. We had a hackathon. We actually generated a lot of things. We, in fact, built some products which are now going into the market. And I think some of these things are of great interest to people because being in proximity to a health system, to a hospital, you can very quickly test ideas at the bedside, very quickly see if they work or don't work, and get the you can really run it by a lot of clinicians who are the ones who are going to be using it at the bedside. Now, is it really going to be valuable later in life? In other words, whatever we're building now, in 30 years is going to be valuable. And this is India's age distribution. If you look at it, whatever you build now, is it going to be applicable in 30 years? Does it really make a difference to the life of a person who's going to be using this product down the line? So I think it's important that when startups are making things, you also think about the longevity of a product, not just about exiting the company. AI is here to stay. Let's accept it. I know all of us use it. I have been using it left, right, and center. AI has helped me make diagnoses. I saw a patient, this was one of those remote care patients I was looking at. Very weird presentation. I didn't know what it was. I thought it might be something. So I put the symptoms into the engine. It gave me a very nice short diagnostic list. I had not thought of two of those. One of them proved to be correct, where when we went back to the patient and asked the questions, we actually looked and said, you know what, this matches. So AI is going to be really an augmentation to what we already do. And I think AI is going to make our life easier, but it's going to need people. You can't do AI without people. So it's very important that we realize that AI is just a tool to help you do things. Earlier today, somebody sent me a beautiful WhatsApp video of somebody playing a Carnatic raga on a violin connected to an AI-enabled device which was playing it simultaneously. Amazing. Just think what else is coming down the line. It's up to us to use it very effectively. It is costly, and we'll have to figure out a way to solve that problem. COVID was a great teacher for all of us. It took a great toll on our collective emotion. Many of us lost loved ones. Many of us are still suffering from the effects of it. But we have forgotten. We've forgotten about masks. We've forgotten about hand washing. We've forgotten about all the side effects that can happen if you're not careful with respiratory illness. But at the same time, we also learned that there were amazing opportunities. Science evolved. We know how to handle things. We know how to make vaccines in months. So these are the kinds of things which, a challenge taught us. And startups should be challenging themselves every day. You need to be running at 100 miles per hour every day if you really want to achieve something. There is no time for complacency. And if you really look at this, Robin Sharma's book on Who Will Cry When You Die, if you think about that, truly speaking, what is the meaning of all the work we do? What is the meaning of all the things we are trying to achieve in life? I think a startup needs to really work backwards on where you want to be. The wonderful panel earlier was very encouraging to see students really be interested in entrepreneurship at such a young age. And I think that's the direction to go. The top right is a reminder to all of us to really take care of your health, preventive health, wherever you are. Cardiac disease is a gigantic problem in India, as you know. And I would hazard to guess that there's about 2 people in this room who should get a coronary angiogram soon. I'm not even looking at you, but I'm just guessing it based on numbers. I think it's very important you focus on health. And if you work backwards from a healthy wellness kind of a perspective, you can actually do a lot. Unfortunately, there are many things which are problems. I'm just listing some of them there. I've been to camps where women still roll beedies and get cuts in their hands and get nicotine sickness. I've seen that there's a mental health pandemic. People who come to me with shortness of breath, half of them are short of breath because they're anxious about something. They're not able to talk to anybody. It's not a lung problem. I have people who have financial illiteracy who are either investing money into things they don't need or getting tests done and paying money thinking that an expensive test is a good test. I have people who have challenges because of distance, where I had a patient today come 6 hours for something that could have been fixed either online or by the local doctor because of lack of awareness that there's care available. I also think that, farmers actually have a lot of osteoarthritis, and they're a completely missed bunch of people where we don't even think of farmers having osteoarthritis. And of course, MDR infections abound. The mosquito there kills millions of people. About 800,000 people die from mosquitoes. We haven't solved that. So when startups are looking for solutions, the coolest, the greatest, the brightest, the fastest is definitely what we should look at. But let's not forget there are challenges which still need to be taken care of. And with your collective intellect, with the collective guidance you have from the institutions around you, I think we can solve that. So there is a wonderful Aitreya Brahmana, the Rig Veda has this, which says, Charaivate, Charaivate. It really means steadfastness is the persistence to remain on the path until the goal is reached. And it really says, keep moving forward. Do not give up because you're going to get honey in the end. So I think we need to stay ahead. We need to look at our deadlines, our grants, our ideas. It's very easy to lose track of the goal. And I think it's important for us to do our best to move forward. I think the question is, you need 1 million patients to get some things done, but the n equal to 1, does it help that one person? And sometimes, anyone know which planet that is on the right? Take a guess. Is it a water planet? Any takers? Neptune? No? It is the Earth, absolutely. So it's the Pacific Ocean. So you're looking at it from, you forget that most of it is water. And you have to take a different perspective sometimes. So my request to the audience, to the teachers here, the leaders here, and the people doing research is, please look at your startup, your idea, with a little different perspective of how can I make a difference? How can I solve some issues which are existing? So I'm going to stop there and just conclude with what our teachers used to tell us in medical college: what the mind does not know, the eye does not see, and the ear does not hear. So I'm going to pause that. And again, thank you so much. I know someone has to rush. My apologies for taking your time before you. Thank you so much.